Spotlight on the Accessible Information Standard. A deaf person's experience in Leeds. November 2022. In an Inclusion for All meeting in May 2020, Jason shared his experience of a wide variety of different things. From ringing 999 via NTL, mobile type talk, to using A&E and Care on a ward. After hearing Jason's experience, the hospital trust did a lot to raise awareness about deaf people's needs amongst staff. Tatum has gone back to Jason to find out whether things have improved. Jason, could you please introduce yourself?
My name's Jason Hickson and I'm the chair of Leeds Society for Deaf and Blind People. I'm also the chair of the Leeds Deaf Social Club. Disappointed I've got no chair of thrones.
When services contact you, do they do so in a way that works for you?
Usually I'll receive a letter and I am better at English than some people, but it is still limited. But I do notice that it'll always say please ring, and it's a Leeds number, so 13, and I can't use the phone. Sometimes I receive phone calls on my mobile and obviously I can't answer it, so I turn it off. So when I've Googled it, I've realised it was the hospital that have been trying to ring, and obviously I'm deaf, so I can't answer.
Can you contact services to make, rearrange, or cancel an appointment in your preferred way?
Usually when I'm trying to change an appointment, or if I want to even book an appointment, I have to rely on my wife, and I can't phone. I'm also at work, so it's obviously confidential information and I don't want to disclose that at work, so my wife has to go in and then has to text, okay, I'm here, and then she'll give me the date and time and check that that's okay. The only problem is when I confirm an appointment on that day, they need to check with an interpreter, and it depends whether an interpreter is available. Sometimes you can be waiting between 1 and 3 weeks. I think it's important in terms of communicating with GPs or even hospitals, but when we receive a text message, sometimes I get a text to say that the appointment's cancelled with no explanation, but you know, I'm not able to respond, so I can't respond and say, why is that cancelled? For most deaf people, it would be really beneficial if they were able to text back.
Can you communicate well with your clinicians via the BSL interpreter during your appointments?
Sometimes in a one-to-one situation, I get most of it, but not entirely clear. And sometimes the doctor can get a little bit annoyed at having to repeat themselves. But with an interpreter, they make sure that communication goes smoothly between us. Most appointments, when I ring or my wife books an appointment, and I usually get a double slot just because with the interpreter it takes extra time to relay that information, so they usually book in a double slot, which is a positive thing. So I think awareness needs to be raised, especially at receptions. Things like a double appointment is needed, who will be ringing for the interpreter, and also not to call on the telephone.
Would you say that the information you get before and after the appointment is accessible to you?
For me, it's mostly fine. It would be useful if staff and professionals were aware that BSL is not English. Most of the deaf community can't read English because it's not their first language. If they get information, it can't directly, translate, especially the longer words. So simplified English would be better, but then that's quite difficult. What's needed really is translation into BSL.
Would you like to share any positive experiences of when your communication needs have been met during the last year?
One thing that was created based on my experience was a befriending service, which is really useful for deaf people that are inpatients, so stuck on a ward, isolated without communication. So the befriending was, an iPad so that you could book a time and speak to somebody, which was really good, would be really good for a person's mental health. The problem is that the deaf community aren't aware of it. I have, told people, but they're just not aware. But I think most staff don't know where the equipment is. So I think more promotion is definitely needed. That could be a poster on, the wards on each floor. Another positive, perhaps, example, it was linked to the COVID vaccination, and it gave me time slots on the phone, so I was able to check my availability and book it.
In the last year, have you struggled to use health and care services because of communication problems?
I don't think that recently I've had any issues accessing, but like, for example, on a Tuesday evening, people talk about their stress in accessing because there's always like a phone number that they need to ring. So it would be more useful if there was a text number, or it could be a video call. And it can be, quite difficult, especially when they go to reception if it's private, and people just don't want to ask the children to ring because sometimes they just don't know who, when, where to call, or what it is about. There's also a problem with timings as well, because if a person works 9 to 5 and they've nobody to ring, then that can be a barrier. Some deaf people have had appointments and they've been told an interpreter is booked, and when they've got there, there's no interpreter, which, is really disappointing. One time when I was in hospital, what was really useful on the first ward, they had the fact that I was deaf just by the side of my bed, which meant that staff could see that, and then that they knew, which was impressive. Unfortunately, the night shift, because it was dark, they just grabbed me and I had no idea what was going on, and they were speaking to me, and I didn't realise I had to point. So I think that goes back to the training. Don't shake a deaf person, look them in the face, move so that they can see, things like that, and move this sign to say that they're deaf wherever they go within the hospital. I did get feedback that some deaf people were annoyed with deaf family members because they got to a door and it had an intercom and they couldn't communicate, so most deaf people just put the finger on the button and just wait it out. And so staff came and were quite angry about it, and they're like, sorry, I'm deaf, I can't, communicate. If they press the button, somebody speaks, they won't know that. So the only solution for some people is just to hold the finger on and wait.
What more could health and care services do to improve the experience of the deaf community?
deaf people have been contacted by Health Watch or the council or other services to feedback, and they've given their feedback both positive and negative, but then they'll be asked again and again, and the deaf community, they're just tired of giving feedback when they see no changes. I remember at Middleton, I fed back about the texting that, deaf people receive text messages but are incapable of texting back. And that was a while ago, and nothing's been done about that. In terms of sharing medical files, they can share that within departments so that information, can be passed on that a person might be deaf. So it's all about communication between departments and services. So I think all frontline staff need to have deaf awareness, so they need training. There is one positive. When I had my accident and broke 3 ribs, the ambulance driver was really deaf aware. So he was using gestures, he looked me in the face, and then when I arrived in the accident emergency, he stayed with me and my wife, the 3 of us. He explained that I was deaf, and unfortunately then he had to go, but he had a lot of experience. One person shouted at me and it's like, I'm deaf. Some basic signs would be useful in there, basic awareness until an interpreter is able to come.
Thanks to Jason for sharing his experience. Produced by Health Watch Leeds in collaboration with Roll Armour.